Hi guys, so my name is Kiran. I'm a registered physiotherapist at Wilson Health Services. So today I'm here to perform just a small video clip in front of you. So where I'm going to treat piriformis syndrome, not in actual, she's Sheetal, my co-worker here. I just think that this is very common condition out there. So we are just going to do one of the treatment, that how I treat piriformis syndrome in our clinic. So say hi, Sheetal.
Hello everybody, I am Sheeta, working in Wilson Health Services as a physiotherapist too.
Okay, yeah, so as I said, this condition is pretty common and there is a variety of the treatments for this condition. First of all, I use some modalities here, as we have many modalities here like shockwave therapy, class 4 laser. So what these modalities do, they bring inflammation down, they bring pain down, and that's how they help to loosen up the tissue. So after that, I always follow up with some stretches. So I'll just perform couple of them. So first stretch is figure 4 stretch in layman term. So Sheetal, will you please bend your knees?
Yep.
So just imagine that Sheetal has a piriformis syndrome on her right side. So I'll ask Sheetal to bring your ankle over the knee here. Okay, perfect. And now Sheetal, are you able to reach behind your knee here?
Yes.
Perfect. And now try to pull your knee towards the chest, and this side knee, push it away with your elbow. So this side is affected. And now I'm going to reinforce this stretch. So I'm giving pressure on left knee towards her chest, and I'm pulling right side knee towards me. And I'll hold this stretch at least for 30 seconds. So we do always minimum 3 repetitions and 30-second hold. So how do you feel, Sheetal?
Yeah, I felt a good stretch.
Okay, perfect. So we'll perform the other one, which is helpful for piriformis muscle as well as a sciatic nerve, because sometimes it mimics a sciatica, because piriformis muscle is sitting right over the sciatic notch and sciatic nerve passes under. So if it's really inflamed, it might compress the sciatic nerve as well. So that stretch is going to help both. So keep this leg straight. And now right ankle over your left leg here. And now Sheetal, I'll ask you to bring your hand here, opposite hand, and pull this knee away. So you have to find a spot where do you feel the stretch. Do you feel stretch here?
Yes, it's pretty much starting.
Perfect. And we are not going to rotate back here. So we'll make back really stable here and push this knee away. Do you feel this stretch?
Yes.
So again, we'll do 3 repetitions of this stretch and we'll hold for 30 seconds. So as I said, this condition is very common. I have found most of the patients, they're working on computer all day long, and there's no time, because according to the real treatment protocol, I recommend them to do these stretches at least 3 to 5 times a day. So where they lack, because they're so busy, they get just one long break and like 2 small breaks, just 15 minutes. So they're not able to do these stretches like at least 3 to 5 times a day. So what I ask them to do, modified stretches. So I'll teach you one modified stretch here. So Sheetal, will you come in a sitting position here?
Sure.
Great. So it's better if you do this stretch sitting over the chair, where you're sitting nice and tall and your feet are planted over the ground here. And now it's right side affected in your case, Sheetal. So will you bring your ankle and put it over your knee here?
Okay.
Perfect. And now I'll ask you to press this knee down towards the ground. Perfect. And again, we'll be holding this for 30 seconds. So it's a great modified stretch which you can do every 2 hours while working. 3 repetitions, 30-second hold. Perfect. So how do you feel?
Yeah, I'm able to feel the stretch.
Okay. So that's all, guys. So I hope this helps.